Hello, everyone. My name is Dr. Kara Wada. I am board certified allergy, immunology, lifestyle medicine, and functional medicine physician. I also happen to be a life coach. And in today's world, with so much focus on staying healthy, I'm getting more and more questions about immunity, and especially about vaccines. Am I still protected? How can I know for sure? Is there such thing as an immune system checkup? These are all fantastic questions. And as an immune system expert and immunologist, it's something I help patients with every day in my clinical practice. We're going to explore how we assess vaccine production and what steps you can take to understand your immune status. Step 1, your story matters. This is the power of taking a detailed history. It's that very important first step in any immune system evaluation, and that is taking a thorough medical history. That, in medical terms, is what is your lived experience? It's more than a quick chat. I think of it as a bit of detective work. I'm an immune system detective, and we uncover clues about how your immune system has been functioning over time. So we will talk about your early childhood. How did things go from the time that you were born through that early childhood, all of those, typical childhood infections? How did you handle those? Did you get your vaccines on time as far as you know, kind of when you were growing up? It's also important to think about this within the context of the generation and the location that you grew up. So someone like myself who grew up in the Midwest with good access to medical care in, the mid 1980s through 90s, that gives me as an immunologist an idea of what vaccines were available and how effective they were given that context, right? Compared to my mom, who was born in the later 1950s, vaccines were a little different back then, right? And her history with that in context, her lived experience of how she handled infections, in addition to the time and place that she was born and grew up and her access to medical care, are all really important as we're thinking about your vaccine records and your medical history. Having a copy of those vaccine records can be incredibly helpful, but many times those are lost over the years. The good news is that many state health systems and health departments have record of these that as healthcare professionals, often we are able to access, or you are able to access, and we can look at together. It's also really important to know your infection history. And I alluded to that a little bit about how you handled infections as you were growing up. But I want to continue that conversation with you to hear, how did your teenage years go? How did your 20s go? How are things going today in the last few years? Have you had any unusual infections? Have you had any recurrent infections? How often have you needed antibiotics? Do you tend to get sinus infections? How are those diagnosed? Have you had pneumonia? And was that seen on chest x-ray? And how did they treat that? The reality is that sometimes when I am talking with a patient and I hear a history of recurrent sinus infections, when we get to the root of what's really going on, sometimes there may be an immune deficiency. Other times, it may be chronic inflammation from allergies that's pushing things over into a sinus infection or making people feel like they have a sinus infection. And maybe there isn't an infection component at all. So all this to say that getting to the root of what's going on, understanding those driving factors and how you are experiencing life through the lens of infections and your immune system protection are all really important. I'm also going to want to know any history of autoimmune issues where immune system has been too overactive, and really just digging into that thorough history of what the timeline has looked like for you, your immune system over the course of your life. Based on that history, based on that review of your records, based on that conversation, then the conversation is taken, do we want to take a deeper look inside? Would some lab testing be helpful? And depending on that individual story, what we uncover in your history, we might recommend some lab testing. We might also be reassured that, goodness, that history is pretty reasonable. Your prior blood work has looked pretty good from what we can see through your medical records. Your vaccination history is great. You're on track, spot on. We don't have to necessarily do labs. This is always really important to have a shared decision-making approach, right? Where we come together and we think about how we're going to use this data. Is it helpful? But here are some of the tools I have in my toolbox as an immunologist to take a deeper look at the immune system and assess whether the parts and pieces are present. It's a quantitative test. And if they are functioning well, a qualitative test. How well is it working? So there are several different branches of our immune system that we think about when I'm getting that history, when I'm thinking about that lab evaluation. And the first is our cellular immunity. These are our specialized white blood cells, our internal army of T cells, B cells, and others that are able to directly attack invaders like viruses, fungi, some bacteria. And the initial test that most people have had at some point in time is called a complete blood count with a differential. This tells us the total number of white blood cells. And that differential piece is looking at the types of white blood cells. How many of those are there? Are there normal numbers? Are they in a normal ratio with one another? Now, if I want to get a high definition view of this, I think of a CBC with a differential. It's the shorthand CBC differential. It's like the rabbit ear antenna TV. If I want to see that high definition look at your white blood cells, I'm going to order something called flow cytometry or immunophenotyping of your peripheral blood. This is going to give me more details, specifically looking at your T and B cells, natural killer cells, and looking to see, do you have enough of them? And do they look to be in the right ratio? So the relationship of those numbers to one another. This is typically reviewed also by a specialized pathologist, a hematologist, who is also going to look for any potential signs or symptoms that may make us more concerned for other immune system issues. Worst case scenario, things like a leukemia or a lymphoma. There are some advanced tests, things called lymphocyte proliferation tests, that expose your lymphocytes, some of your specialized white blood cells, specifically your T cells, to substances that we know should cause them to proliferate or multiply. So we send off blood. Typically where I am, this blood gets sent down to Cincinnati, where there is a big immunology lab that runs these tests. And they will expose your white blood cells, your little lymphocytes, your T cells, to substances called mitogens, which should get them jazzed up, should get them all excited, make them become activated. And that is measured. If someone has a good or adequate, sufficient proliferation to those mitogens, that is a good thing. We also are able to check for immune system memory through that part of our immune system. These are called lymphocyte proliferation antigen tests. It exposes these T cells to Candida yeast, which we are all exposed to on our skin. It exposes them to tetanus toxoid, which is in our tetanus shot. And so that can help us assess to see if we have cellular memory intact to these things that vast majority of us have been exposed to over time. Now, if I was checking that test in someone who had not had any exposure to the tetanus vaccine, I would expect or anticipate seeing a low level of lymphocyte proliferation to tetanus, right? Or if someone needed their booster, that level might be low. We might suggest they get their booster shot, recheck that, and see if their immune system has responded adequately as it should. Moving on to the next part of our immune system, the humoral immunity. This is your antibody arsenal. This tends to be encompassed primarily a protein-based aspect of our immune system, but these proteins are produced by our B cells and a special type of B cell called plasma cells. These are protective proteins. They target specific invaders. They allow our immune system to create specific types of immune system memory. So how do we measure these? We can check levels, quantitative immunoglobulin levels. We can check levels of our IgG, IgA, IgM, and IgE. There also is something called IgD, but we're still not 100% sure what purpose that fulfills in our immune system, other than when it is high, it seems to be related to an autoinflammatory issue. So anyways, more on that in the future once we learn more. The other way we are able to evaluate for this type of memory, specific to understanding if our vaccines are working, is we can check for antibody levels to specific vaccines, and this can give us a snapshot of your humoral immune response. Often, I will check these to tetanus, again, one of those common vaccines we get when we're very little. If you're a healthcare professional, you may have had your hepatitis B titers checked, or occasionally varicella or chickenpox antibodies levels will be checked. Now, it's important to know that vaccine titers may not always be positive in someone who has had their vaccines. So vast majority of people will create antibodies specific to those vaccines, but there are a portion of people who are called non-responders. And this is a little bit of a misnomer because we do believe that a good portion of those people do make that cellular immunity that we don't have as good of a way to test to. And so we do have some numbers to understand that a bit better based on a particular vaccine. There also are some people who are a bit more prone to being non-responders. For instance, folks who have celiac disease may be at a little higher risk of being a non-responder to the hepatitis B series. The last part of our immune system that I often will check, if someone's wondering about immune checkup, immune deficiency, it's our innate immune system. These are our first responders. Oftentimes, these are tests that will kind of do a one-time check to see if there is something kind of more genetically responsible for causing someone to have an increased risk of infections. And so there are several types of proteins, one called the complement cascade or complement system. There's another aspect called the lectin system. And so we are able to check a comprehensive complement test called the CH50, which looks for all the pieces, make sure that they work together. And there is a test that I will occasionally order called a mannose binding lectin level. And this is a little bit debatable as to how helpful it is, but in a certain context, a certain patient, I have found that to be helpful in understanding what's going on with their immune system. So vaccine titers, I mentioned, are important, but they're not always the whole story. So it's important to understand that these are not a perfect measure of your long-term immunity. So your immune system has memory, and it has the ability to make memory in several different ways. Your antibody levels are one type of memory that are created by your B cells and plasma cells. The T cell memory is not as easy to assess when it comes to lab work or skin testing, things along those lines. So that is why it's really important to take that history that we gain from that first part of that evaluation, understanding who you are, what your health is like, the context of where you grew up, the healthcare you are receiving, along with lab markers to put those clues together to really form the whole picture of the status of your immune system. So when we think about taking charge of your immune system health, is there an immune system checkup? It's not in the way that we typically think of a routine physical. It's really by combining this detailed medical history, your lived experience, the context where you grew up, with, depending on the circumstance and that conversation, targeted lab testing that can help us gain valuable insights into your immune system status. It can help us uncover potential weaknesses and create a personalized plan to help you thrive. If you are concerned about your immunity or your vaccine protection, talk to your doctor. You could also talk to a board-certified allergy immunology physician who can be a partner in understanding your immune system and building a healthier future. And if you're looking for more information and support on your immune health journey, be sure to join my free Facebook group, the Becoming Immune Confident Community. I've also created a free immune system disorders pre-appointment workbook. It is jam-packed with helpful questions for you to go through before you have that next conversation with your doctor about your immune system. It also includes some tips for making the most out of that appointment. I'll put the links in the description below. And if you haven't heard already, I am just about to launch my new telehealth medical practice, initially in Ohio and then expanding to other states as well. If you are not on the wait list already, or if you want information on scheduling, you should hop on over, get your name put down, get on the list, get scheduled, and also leave your questions below. I love having these nuanced conversations about vaccines, but I will say if you are trolling, if you are not contributing to an ongoing discussion in your candidness and willingness to listen and have a dialogue, then you're getting the boot. We don't have time for the trolling. So make sure to like, follow, and share. Let's have these challenging conversations about our immune system and do it in a respectful way. Take care.